They found it was not feasible, so they trained only 3 of us. 3 of us were trained from each college. Now they made 2 zones. One was in the north zone, was in Delhi, and south zone was connected in Chennai. There were about 9 centers in Chennai. The rest of the centers, 8 centers were there in Delhi. The same faculty, instead of this is the plan, but otherwise 3 of us are there. Now what we are supposed to do is, each regional center, now we have 15 colleges, we will be training 3 from each college, like coordinator, the co-coordinator, next person, and one at least compulsory person, another person from the preclinical. One preclinical, because early clinical exposure is there is a integration, and basically it is first year. Preclinical person, one coordinator and a clinical person. We be trained. They will come back, that is there are 314 colleges, in each of these colleges, 3 will be trained. They will come back and train in their institute minimum 35. In a workshop like this, suppose I'm a MU member from here, I will be training 35, chosen from preclinical, clinical and few from the paraclinical. Because except for the electives, as of now, paraclinical is not much, except for the integration. Because early clinical exposure will go to preclinical and clinical. And professionalism, all this will go to MU and preclinical. So, like this, choosing 35. And those 35 are not only responsible for doing all this work, they will in turn go back to the departments. Because these 35 will be picked up from 2-3 from each department. So, they will go back and train their respective people in the departments and they will be known. This is how the SCI developed a network and they have. So as of now it is stopped at this stage. We had set the dates, but MCI sent us a mail or told us to keep it in abeyance. I don't know when they will send us a further intimation for this. Probably if they send it tomorrow day after something, maybe another 15 days we will call it refund. Now objectives for the regional training center. What we should do in this, what is our role? Regional training center, what is as a regional training center, understand the curriculum reforms in terms of aim, structure, content, understand everything, and acquire knowledge and skills for implementation of the new curriculum, educational exercises, teaching learning methods, assessment methods, developing the modules. We first have to understand it. For the curriculum evaluation, conducting training workshop for the MU team for medical colleges, just not understanding, we also have to convey it to the other colleges. Then mentoring and supporting the MU team members from medical colleges under them. Like we will also be helping support for all the 15 colleges whenever, as and when they need support. If one training program is not enough, maybe we can conduct another training program. Support that doesn't mean that we develop the modules and give you all. That's why I'm specifying. If you have difficulty, we can come back, or maybe we will conduct another training if it is not sufficient. This is what MCI does, not clear. Then what is the role of medical education unit team here in each college is that same thing, they understand everything, they acquire skills, knowledge, trained by their faculty, curriculum evaluation, everything, and mentoring and supporting the faculty from their college to implement. Anybody goes with any difficulty, any time, they have to be patient, they have to spare time and support each department. Because MEO team has a large responsibility, not only doing it for the institute, they have to develop their own modules for professionalism and everything, but they have to support each department also. Whenever each department conducts any workshops, they also have to do this. Then faculty, there are certain responsibilities of the faculty of medical colleges, understand the new curriculum in terms of its aim, structure, content, process, and flexibility. Same thing, individually each faculty also needs to understand and acquire all these skills and abilities. The commitment for regional training center for this is time commitment for faculty and teachers of our own institute as well as 15 medical colleges or the other institutes. Local support for workshops. If you want to conduct workshop, one is not sufficient. You want one more, we can send one more person to train you. They will do 2 workshops as per the MCI, then one for the MU teams of affiliated colleges, as I said. Another one is one for the faculty of our own college. So our team has to do 2 tasks. The mentoring of affiliated colleges and implementing the curricular reforms. This is the commitment for regional center. Thank you so much again. Post lunch, everybody have given up a good lunch. You kept yourself awake and kept me also awake. After this, there are still many more questions. There are lot many issues that are unanswered, and if it actually comes to implementing, we are always there. Regional center, anything, we are always there to support. Anytime. Sir, I'll tell you, MCI, last time when we went for May this thing, NEET was still under abeyance, and without our knowledge, frankly speaking, we didn't know when it came on the website and everybody was discussing, we went back and saw. When they implement what they do, we don't, without any information. Actually, as of now, when during our training, even the governor, member of governing body was there, that time also they said that it will be implemented for the batch of 2013. So what they said is start training now. You have 1 year period to train, get accustomed to and develop all these modules, prepare before they come for August. Develop everything. This is what was their idea, 1 year. But again, when everything was fixed in July, they said keep it in abeyance till further orders. Still not come out for any further orders. We will not get it for 4 months, we may not get it for another year. As Madam said, we will do it. Their vision is till 2015, all those have to be implemented, not that beginning. So that beginning with these, so the new areas of trust, whatever we discussed, electives, students, planning, practice and all those to be implemented by 2015 is their vision. So there, this is the phasing thing. So we also don't know when they are going. We may implement it in 2013, we may go and look at the way they are going now, but looking at the again, we felt that anytime it can come up. Because without any sudden further, there was not much of a everybody was in Zoom, that's the incomes.
Madam, with this change in curriculum, did NCA say anything about the SAP pattern?
No, madam. This also discussed in May when we went to Chennai. This was also discussed with the same, because MCA has allowed to increase the number of seats in all, apart from the changes. Leaving out these changes, they are increasing up to 250 seats in the same existing infrastructure and faculty of 150. Whatever is there for 150 can be added into the 50. There is already an added responsibility. Out of this, plus this. This system, MCI is no more. Whenever we can, then we put it in
This something you should recommend, increase the number of posts.
Definitely, no, this has come. It is not you and me suggesting there. I'll tell you all those from education institute. Hear the name Dr. Avinash Sukhe, you must have heard, then Dr. Rashmi Raj, all these made it, Payal Bansal. All these people who have developed this curriculum. These changes, these models, all these, those people only said. You asked us to develop, we have developed. But ultimately, we are also implementing. The question was, they are also medical college faculty only. Ultimately, I am also implementing. So how about implementing? You are giving us so many responsibilities with the same existing infrastructure. How can it be brought about? And they said, no, we will recommend it in the meeting. That is also not maintained, sir. That is also recommended. Same thing was said when is the teacher infrastructure. That is also not.
Please have your attention, please. Stay close. Good morning, everybody. Good morning to my teachers, teachers of the medical college, my colleagues. Welcome to day 3 of this workshop. final day of this workshop. Final day of this workshop. Last day of this workshop. See, what has happened is, in these 3 days of workshop, day 1, you have been bombarded with what exactly is the anatomy of knowledge, what exactly you mean by the taxonomy of knowledge, taxonomy of learning, physiology of learning, what are the various methods a teacher can be to the student. These things was taught you in day 1. In day 2, the same knowledge, how you can impart to the student. What are the various media by which you can mediate or you can teach the students in the form of AV, audio-visual aids, which was told excellently by Dr. Kavita. What are the various methods of audio-visual, uses of Blackboard, PowerPoint, etc., etc., etc. Now the day 3 comes the most important one for a teacher. What is that one? Yes, now we have to assess them. Okay? We have to assess them, the knowledge what we have imparted, whether it has really gone to their head or not. Okay, that's the thing. That is the most important thing we will be dealing on this day. At the outset, I want to thank Dr. K.G. Basarajappa, my head, without whom I never been involved in the medical education department. I'd also like to thank Dr. Shashikala Madam for all guidelines, and Dr. Kapoor sir for making my PPTs more colorful. Even though it is black and white, he has instilled some ideas. That is the reason why he has made my PPTs somewhat colorful. Right, to start with, see, the objectives are at the end of my session with principles of learning. You should be acquainted with these terms. Define evaluation. What are the various steps for evaluation? What are the types of evaluation? Next slide. What are the characteristics of an evaluation tool? What are the various list-wise, domain-wise methods? And lastly, selection of appropriate instrument and tools so that we can conduct examination in a very, very appropriate way. Right? Next slide. Assessment is a key element in the process of teaching learning process. Is it right? It's the most important one because it's going to reflect your performance. The teacher, the students acts as a mirror here. The performance of the teacher is almost in line with both the student and also the teacher. That's the most important one. Assessment determines how knowledge has been imparted and what the students have learned. In a lighter way, assessment also determines the distance between principal office and your department. Assessment also determines the distance between principal office and your department. In a lighter way. If you are not evaluated properly, the results will be poor, and of course the principal will call you for a meeting. Okay, so the less the distance, the more bad is the evaluation, and more the distance is very good is the evaluation. In a lighter note. Next slide. Assessment is defined, it is a systematic process which measures the extent to which the predetermined objective has to be attained. That is the most important one in any teaching or in any evaluation process. The most important thing, see, we as a teacher, we forgot this, the most important one is the predetermined objectives. We forget that one. So even before we take a class, we should first list out what exactly the objectives are and how to instill into the student mind. That is the most important one that we don't do commonly. So it is a systematic process which measures the extent to which the predetermined objective has been achieved. So how we should do that? How to go about it? So in order to assess, you require some appropriate instrument. With that instrument, you are going to administer to the student. After you administer to the student, you are going to collect the feedback. That is the most important one here that most of us are not doing here. You have to take the feedback whether our evaluation process is correct or not. Okay? Then assess, again reassess, and again if there is any change in the defining of the objective, then verify it and change it. So that's the circle what we have to go on in the assessment section. Next one, please. Now, what is the application, or what is the purpose of the application assessment is commonly made? Any purpose assessment?
To read, to find out whether the goal has been achieved or not.
Any inputs from Miller team?
Depth of the knowledge.
Depth of the knowledge. For the student's perspective, is to qualify or not? To qualify the examination. Purpose of evaluation, student So ultimately, what are you going to achieve? After doing the assessment, what exactly will happen? Whether it is qualified or not, whether it has been promoted or not.
And not this exam, every day after every class there should be an assessment to know whether they are doing it properly or the student is understanding properly.
Right, sir. Thank you, sir. Thank you very much. So, the application for the purpose of the assessment are as follows. It may be for some selection criteria, for some examination or some university for some degree. For the promotion sake, yes, some universities also conduct some promotion sake so that he will be promoted. As a pre-test to categorize students, incentive to learn, feedback in terms of strength and weakness. Yes, definitely. By taking the feedback and also by looking at the student's strength, we can place them who is the poor learners, who are the marginal learners, who are very good at this time. Okay, these things also we can make out. Now, what are the types of assessment? Two types of assessment is commonly done. One is called as the formative assessment, second one is called as summative assessment. What do you mean by this formative assessment? Any idea? Huxley team? Formative assessment.
Evaluation during the course, step by step, at the end of every step will go. Summative is at the end of the whole session or at the course.
Thank you very much for that, madam. Next slide, please. Formative assessment is continued monitoring of learning activities. Thereby, student improves by the way of feedback. Early morning, 8 o'clock class, go to the class and give a surprise test to the class what you have taken the previous one. In a practical class, give some assignments. Pick and speak. That's what I think sir was telling you. Okay? That is the continuous way of monitoring of the student that comes under this heading called as formative assessment. Now, by doing this formative assessment, we can identify the weakness and strength of the student. That is the most important one. So that we can give guidance then and there only. No, you are weak in this point, you are strong in this point. You have to keep a balance on it. So that is the main importance of this formative assessment. Yes, as Madam told, it performed at regular intervals and covered small portions. That is the highlight of this formative assessment. Coming to the summative assessment, it allows to certify the competency on completion of the course in the form of mark, grade, rank, pass. Something like a university examination, term examination. Okay? At the end of 1 year, we are going to conduct one examination. That is what is the summative assessment. The most important difference between this formative and the summative is there is no feedback system in case of the summative. Okay, but whereas the feedback exists in what is called as the formative assessment. That's the most important one. Next. Now, in order to perform this assessment, we need to have two important components. What are those two important components? One is called as methods. Another one is called as the instrument. The instrument is also called as a tool. What are the common methods we use? The methods used commonly are written examination, orals. Third one. How you do? One is written, another one is observation. That's the one. Okay, I was wanting for that one. Observation, another one is orals, another one is written examination. These are the common methods. And the instrument thing, I think I will tell you later. Now, in order to have or in order to apply this assessment properly, you should have certain characteristic feature for the instrument. You cannot use all instrument at a time. You should have some characteristic feature in each instrument. Now, what are those important characteristic feature? It's something like this. One is validity. That instrument, what you tend to measure, should truly measure what it is intended to measure. Second one is reliability, consistency of results. Even if you perform that test today, even if you perform that test 6 months afterwards or 1 year later, it should give the same results. So that tool should have that reliability. Relevance or the appropriateness. That's again the most important thing. For example, I want to give you here. There was one community medicine Viva was going on. He was a very strict examiner, supposed to be a very, very strict examiner. He asked one question to the student. What are the species of mosquito which is commonly seen in the White House of Washington DC? That he is asking the student in Davangere. So what may be the appropriate question would have been? What are the important species of mosquito in Kundwada? Would have been an appropriate one. Okay, so that's some important concept we have here. Next is objectivity. So this is again the most important thing. I think every department has to take care of this, the concordance between the examiners. Okay, 2 examiners value, 3 examiners value the same paper. It should give the same result. There should not be any bias. Last is feasibility. This is the most important thing again. You should have a classroom, you should have a paper, you should have time for that. Okay, so the examination tool or the examination instrument, what you are using, should have all these characters. Just I want to repeat this one. It should be valid, it should be reliable, it should be relevant, it should have an objectivity, and it should also have the feasibility. Validity refers to what test actually measures. Validity means that the evaluation instrument serves to determine the presence and absence of the desired characters. Most of the time, we are going to ask questions in the validity in the must-know category. Okay, there is one must-know category in the syllabus, right? Okay, so most commonly, we have to focus on that when you talk about this validity point of view. Next slide. What are the important factors which influence the validity? Ambiguous questions. Okay, ambiguous question. Poorly constructed question. I mean, that question, it will not be understood to the fellow examiner also sometimes. And how can the student will answer? Test may be inappropriate for the behavior to be measured. If you want to analyze something, some psychomotor analysis or psychomotor behavior of the student, if you do a test on the cognitive domain one, then that's what I mean by inappropriate behavior to be measured. Next is the reliability. This refers to the consistency of the results. A good instrument should give the same measurement or the same performance on different occasions. I think this I explained. Okay? Even if you do the test now, after 6 months, after 1 year, the result should be same. It should not differ. Okay? There should not be any seasonal variation. Okay? It should be reliable. Next slide. If 2 or more expert examiners are valuing the same paper independently, the score obtained should be the same. This is where the most departments should take care of. Almost same. All departments should take care of. Okay? So what do you have to do for that?
Model answers should be prepared, and the examiners should be given those model answers like whoever is evaluating the papers. Okay.
After the final exam, we have to take the question paper and discuss among the eligible evaluators that this is the minimum we expect in the answer, and this should be the grading system. I think that will
And university has to implement valuation metrics for the evaluators, because some people simply blindly mark and some people see. And I have seen third valuation, since ours is the third valuation center, a difference of I think more than 40-50 marks. 0 I have given 1, probably somebody would have given 60 something like that.
And timing of valuation, duration, okay, that should be really fixed by the university. Because some we have seen they'll be completing one bundle in half an hour, 1 hour. I'll be just wondering, we'll be sitting and wondering how it is possible to do that.
Textbook also will be different textbook and different answers. For the same question, so answer is different in different.
Okay, next slide please. How objectivity is achieved? I think you all told the answer to me. By structuring the questions, preparation of model answers, agreeing on the mark scheme, having papers independently valued by 2 or more examiners. Okay, so the idea, what's the main idea of this is we should not be biased. Okay, no student should not be felt that I have given less marks due to one particular exam. And as sir told, the prior departmental meeting and also prior SLOs, okay, so whenever you are answering or whenever you are correcting any papers, please ask the university people to give you what is your SLO, specific learning method, learning objectives, so that by virtue of it, you can do justice to the student. Next is the feasibility. Okay. So what are the important factors just to be considered here is the time. Okay, whenever you are going to write, remember you want to do an examination, you should have time first. And next is the resources. The paper should be there, the pen should be there, the student should be there, of course the staff should be there. You cannot conduct a test when all of your staff has gone to a vacation. You cannot do that one. The second one is it should be easy to administer. There should not be any very complicated one. This should be very easy to administer. The scoring pattern should be very easy, and also the interpretation. So this is one small cartoon. Hey, you can stop correcting those papers. I found a scientific equation to get a quicker evaluation. What is that one? Number of pages plus diagrams divided by size of handwriting gives the gives the marks. Okay, sometimes some people will do that one because of the want of time. But please don't do this one. Next slide. This is what I was telling you the other day. See, your reliability and validity whether your test is reliable and valid, it is said when it hits the bullseye constantly. That bullseye is nothing but your must-know area in the university syllabus. So the second one is it is unreliable and invalid. Agreed? All of you. And the third one is it is reliable, but it is invalid. It is hitting one particular place, but it is not valid. So finally, the most important one what you have to do is analyze the health needs. Okay, what is the public health problem of that area? Prioritize the topics from it. Okay, and then use an appropriate examination tool so that you hit the bullseye where you should talk about the must-know aspect, and the other one is the desirable second period. Next slide. So what is the domain-wise assessment methods? I think we are talking to you on these 3 important aspects since 3 days. So in order to determine the cognitive levels, the assessment commonly we should use are written and oral examination. Psychomotor is observation. Affective is also observational because you are observing the skill levels. Next slide. So what are the important steps in the evaluation? So define an objective. So this is the most important thing. At least by the end of this workshop, one should learn how to define your objectives. Please start your class by defining your objectives first. Then sum up your class. That will change the scenario of your teaching. Now, define the objective, provide measuring instrument, select measuring instrument, administer the test, decide making, score test, analyze the test, take a decision, and lastly that I have not included is take a feedback. Take a feedback, assess and again reassess. Okay, that's how the cycle or the steps in the evaluation should go. This is again the most important one. See, the first one is the domain for what you are going to think about. Next is the method, the written examination. So, for the cognitive domain, the method is written examination. So, what are the instruments there? It is essay question, structured essay question, short answer question, multiple choice question, problem solving questions. And in the orals, you can also do a orals for the cognitive method. The analysis one, logical thinking of the type of the questions. For the psychomotor domain, the method is the observation, that's what I told. The instrument, what you have to use the practicals, the clinicals, OSPE and OSPE. Last is the effective method. The method is the observation, the rating scales, checklist, questionnaires, and the group discussions. Okay? So these are one of the most important things you have to know before you evaluate the student. What component of the student you are going to evaluate is the most important thing in my lecture. Next slide. That's it. I think I have a task here.
A candidate will not perform on the assessment time, that is during the examination, because of the so many personal reasons. We have false, so many reasons. So we don't consider other like this regularity, this attendance, its academic activity throughout the course should be considered in addition to this evaluation or assessment.
This can be noted alone. If in an assessment, if a particular student doesn't come to examination due to some reasons, but he is very good in attendance and very...
Sir, it all depends on what type of assessment. If he does not come to the examination, there is no way we could pass him. Yeah, that is where the formative assessment helps. That's why, formative definitely helps.
The madam is going to perform a small experiment regarding the reliability and the objectivity concept.
We got these curtains recently. We changed the curtains which we had, which we were using for the medical education unit. So the task to select the size and all was for Kavita. She did something. How it went on, I'll tell you. So first, because she had to send somebody else to get it. So the measurement, I think you all remember Dr. Prema, Dr. Nagappa, how Dr. Srinivas taught us about these terminologies: reliability, validity, objectivity, subjectivity, and all that. This is a measurement of this. Please tell us the measurement of the table. See, Kavita did not have anything, so she could do it. So just like that. So just see and tell us how it is. Don't use. Single examiner, so many others are influencing them, So it's like helping the student to get the answer, not examiner. No. I just want you. Nothing else. You should stand there and table is here, please. No touching or anything. Okay, length is enough. Length is enough, sir. Oh yes, thank you. Thank you, sir. Thank you, sir. So Dr. Parvati Gowda says it is 100 centimeters. The length is 100 centimeters.
It may not be. It may not be 100 centimeters.
It may not be 100 centimeters.
Roughly, it may be 100 centimeters also.
Roughly, it may be 100 centimeters. Somebody said some feet. 4 feet. Okay, just the length of it, not the breadth. 4 feet. Okay. Was he able to measure it? Was he able to measure? Measure? So what method did he use? Observation. Observation. So we use this method in many of our examinations for evaluation, practicals. Yeah. But he has used observation. What was the instrument he used? Eyes. Eyes. So valid instrument. There's so much of subjectivity there. Now what he says, I don't agree. So probably I will say it could be 115 centimeters or 120 or 130, whatever. So this is subjectivity. So not all of us are agreeing with what observation he has made. So there is no standardized way that is done. That method also is only observation. Yes. So let us refine it further. Somebody else who could come and measure it. Somebody else. Okay, sir. Dr. Sunil. Anil became Sunil. So you're measuring it with your palm. Yes. That is it. Okay. No, sir. With your palm, how many? Okay, 6. Yes, sir. Thank you, sir. So 6 palm length according to Dr. Sunil Kumar. Who else could come and do this? Sir has got measurement fixed. Who is tallest? Dr. Venkatramana, Patil or Yogesh Babu or Umakant? Tallest? Umakant? Very okay. Similarly, so there is this student is again assessed by another examiner. He said 6. For Dr. Venkatramana, it is? It is 5.5. Yes, sir. Thank you. See, don't you think it is different? Both of us have used the same. They have used the same instrument. But why is it same yardstick? Why is it differing? What do we call this as? Subjectivity. So no two people here, they are agreeing with whatever is the result. So is the instrument they have used valid? No, it is not valid. So there is a lot of subjectivity here. What is validity then? Validity is, no, what is validity then? In definitions. Is there consistency here? No, there is a lot of subjectivity. So we are not agreeing with this. So what is validity? Validity means the evaluation of instrument that serves to determine the presence or absence of desired characteristics. So validity, ability to measure what it intends to measure and it should do it. Okay. What it intends to measure, truly measures. It may measure, but we don't say it truly measures. So, okay. So what else could be done now? Somebody else? Dr. Shailaja. Irrelevant. Use approved standard method. Yes. So what we have seen is subjective, lot of errors. So we don't agree. No agreeability between the two examiners. Yes. So we have another instrument now. So Dr. Shailaja is going to measure it using that. Same length, yeah? Jayasimha? So somebody else, if we could, she's done it properly, Ishmantu? One minute. Anybody else who could measure and say that she's done it or it's agreeable? No, this one, if anybody, somebody else comes and does it, Kavita, do it. Thank you, Ramesh. Yes. You know, we are agreeable. Though not 100%, don't you think we are agreeable? So this is, shall we say this is a better method? Better method, more? This is more valid than earlier. But still, can we accept it as a standardized method? No. This is so much of subjectivity, we are not agreeable. So what else has to be done to exactly measure the size of this? We have to use a measuring tape, a scale, which we say is standardized. So shall we do that? Jayasimha? Very good. Kusum? So the earlier measurement was 100. So 30 centimeters different. Thank you, Kusu. So if somebody else measures also, does it remain as 130 or will it increase or decrease? So it will remain the same. Okay. So is it a valid instrument now? Valid? No? So why is it not valid? Okay, so this device we say is certified by the Weights and Measures Department, so calibrated, and what else? Okay, so we'll say, yes, a measuring tape. So we'll consider this as a measuring tape and then we are using it to measure this. Then what are the characteristics of this? Let's say it is valid. Valid. We'll take all the criteria. Now I should have got a measuring tape, but it is a scale. Valid. Because it is standardized. It's predetermined. No, the length of the scale is predetermined. So what we assess in the student is predetermined objectives. So what lesson plan, what objectives we say, by the end of the class, by the end of the session, the student shall be able to do this or do that. So we are going to determine or measure what was predetermined. So this is a predetermined and quite a valid instrument. So we will say this is reliable. Yes, consistency of results. Whether I measure or you measure, it gives the same result. So it is reliable. So relevance or the appropriateness here, yes. But if this test asks for a medical student, if he asks a medical student to measure something table, this is not relevant. If we ask him to measure something else, the size of an organ or whatever. Objectivity, is this method objective? Yes, we all agree. So objectivity, concordance between examiners, and anybody does it gives the same result. So it is so objective. Feasibility, if this is what we want to examine or determine. Possible, feasible, yes, feasibility is one. So we all agree with this instrument as a standardized one, so which could measure, it's a measuring instrument. Okay. So next, so we all agree with the nature of this. Or at least understand what is validity, what is reliability, what is relevance, what is objectivity, and then what is feasibility. So ease of implementation. So when we look at feasibility, we know what is the objective that has to be assessed. For the classes we said, what is the objective? So what we want the student to learn. So here in evaluation, we are just testing what the student has understood. So what he has learned from the objectives we have taught him. So this is about this validity, reliability, relevance, objectivity and feasibility. So there are questions if we just look at some of our question papers. So whatever has to be tested using psychomotor skill, sometimes it comes as a question also. So a note on how to prepare a peripheral smear. So the methodology is not for writing or testing. So that's about these terminologies which Dr. Jayasimha was telling you. Thank you.
Thank you very much, madam. I have given a group activity. Yeah, this is the one. Group task for assessment. First question for Harden group. Second question for Huxley group. Third for Miller group. And fourth for Bloom group. Srinivas group is an observer. This is they are observers. The observers.
Instrument